a chance to get on here. But my name is Dr. Isang, cardiologist, using this platform to discuss things regarding the heart, health, and prevention, and why. Because that's the best thing that we can do for our economy, for everybody overall. It is a very difficult thing to treat when it comes to heart disease. So if you have the risk factors for it, you can potentially prevent a heart attack from happening. So this is what I aim to try to discuss with people why this is extremely important. Well, it's a non-cardiac question, but Buffalo Bills over the Chiefs. It has to be the Chiefs. Unfortunately, to be the best, you got to beat the best. So the only reason that the Bills may have a chance is due to age. The Chiefs are getting older and older over time. So Ronnie Shorts, what's going on? I hope you're doing well. I'm only going to be on here for about 10 minutes, so I'm just here to discuss things regarding the heart, regarding health, regarding prevention. If no one has any questions, then I got my little spiel when it comes to things like heart attacks, chest pain, high cholesterol, etc. So let's go. Is Red Bull bad, bro? I drink like 500 mLs 3 times per day, sugar free. That sugar free is actually a misnomer. It has sugar in it. That's how you have taste. It has pretty much some bad sugars in it. Those sugars are actually being studied now, and there's a huge link to heart disease and to cancer. So, is Red Bull bad for you? Yes, and you're drinking over the maximum amount of Red Bull. Unfortunately, can lead to a lot of cardiac issues, especially issues with heart rhythm problems. People can have things like palpitations anywhere up to SVT, crazy heart rhythms. So, uh, as best as you can, try to limit the amount of energy drinks that you consume. One of the questions was about, do you know much about prolonged QT intervals? So yes, that is, for women, I think anything above 430, and for men, anything above 460. I may be off by like 10 for each, but we get nervous because the more it prolongs, the more it can lead to dangerous heart rhythms. You can have a skip, an extra beat on top of another beat, which can lead to scary heart rhythms. So, when someone has a prolonged QT interval, we want to make sure number one, is there any medications that can be potentially causing this to happen? If there is, you want to kind of reduce those medications. Notorious medications includes things for nausea, things like Phenergan or Zofran are notoriously known for it. A lot of some antibiotics can prolong the QT interval. There's some medications for anxiety, depression that can also prolong the QT interval. Some people also have genetic predisposition to having it, something called long QT syndrome. So basically, we get nervous when the QT interval, is approaching 500 and beyond, can lead to scary heart rhythms. So if there's any offending agents, you try to remove those medications to hopefully prevent it from happening. Panella, I appreciate you. Either Panella or Panelia, depending on if it's a Hispanic or non-Hispanic name. I appreciate the sub. Panella. Okay, got it. Perfect. So just a brief when it comes to chest pain. What do we get nervous about when someone is having chest pain? Chest pain here in the sternal region radiates to the left shoulder, left arm, associated with stress or exertion, physical stress, someone stressing you out mentally, and gets better with rest or a medication called nitroglycerin. If you have any of those, then definitely want to go get seen as soon as possible. May want to be seen by your primary medical provider, urgent care, ER, because if you have those symptoms with appropriate blood tests or an EKG, then it can lead to a heart attack. So if you're having that, you may be having a heart attack. So we want you to stop whatever you're doing, go get seen, and possibly get a cardiac catheterization to look for a potential blockage. If there's a blockage, they would open it up with a stent. If there are scary blockage or blockages in scary locations, then you have to consider open heart surgery, coronary artery bypass graft, also known as CABG. Can I work out if I have a urinary tract infection? Yes, hydration, seeing your medical provider just in case you need to be on antibiotics. But hydration is going to be one of the biggest things. Finishing the antibiotic course that you have. A lot of times people are put on medications for UTI and other infections, but unfortunately they don't finish it. They take it as much as they can, and then when they start feeling better, they stop taking it. This is what leads to antibiotic resistance. So when you're not taking it appropriately, your body, but more importantly, the organisms that you're trying to get rid of get used to it and can develop ways to fight against the antibiotics. So if you're on antibiotics, finish the regimen, maintain hydration, but most importantly, follow up with your medical provider. I got about 5 more minutes on here before I get back to studying. So any more questions, I'll do my best to answer them. So I talked about chest pain and um, how long does it take to cure? Each it depends on which antibiotic is used. So it can be anywhere from a 5 day course, sometimes 7 to 10 day course, just depending on the antibiotic and the type of bug that's growing. Especially if the bug is cultured and there shows some resistance. But that's out of the realm of my specialty. So I'm only giving you based on prior knowledge of when I was practicing treating people who had urinary tract infections. Got it. So we've talked about chest pain and what we can do. So if you're not having a heart attack, but you've been having chest pain, what else can we do? We can do a stress test where we try to see if we can elicit those symptoms again by putting you on a treadmill or doing a chemical stress test. We can do an echocardiogram, an ultrasound of the heart, lets us know how well the heart's squeezing. If there's a reduction in the squeeze function, then that's an indication of getting a heart catheterization to help explain why why there's a reduction in your ejection fraction. Could it be because there's a potential blockage in one of your arteries that caused that? And a lot of times, if the stress test is normal, labs are normal, but you're still having symptoms despite optimal medical management and lifestyle changes, then we still may proceed with a cardiac catheterization to make sure that despite everything looking good, it's you don't have any potential blockage. So what if we do a heart catheterization and everything is normal? Then we have to start looking at non-cardiac causes of your chest pain, things like your gallbladder, your colon, your GI tract, the bone on your chest. It can cause something called costochondritis. You can have inflammation around the heart, pericarditis, the muscle of the heart, myocarditis, your pancreas, pancreatitis. So there's a lot of different etiology, different things that can cause chest pain other than it being due to a heart attack. I'm going to take this moment to answer one more question regarding the heart, regarding health and prevention, and then I am off. This was a good opportunity to be able to talk about all of this. So, I have my first appointment with my cardiologist soon. What can I expect with this long QT interval? The most important thing they're going to ask is how you're feeling. If you're feeling well, then typically we may not do anything regarding it. We may look at medications to see if there's anything that's causing this long QT syndrome. We may look at a strong family history. So, the one thing I would want you to do is come prepared with knowing what your family history is, especially if there's anybody who has any potential cardiac issues in the past, anyone who's had a heart attack, anyone who died unexpectedly. Because those are the questions, those are the things that cardiologists would want to know. And then they'll look at medications and they'll get another EKG because it could be prolonged QT for somebody, but for me, I'm okay with it being where it's at. So, um, why do you have to go? I got to go back to studying. I did not like the nuclear stress test. Yes, yes, no one really likes it. That medication, it depends on which medication they use for the nuclear because it can make you feel uncomfortable with it. It can make you feel uncomfortable. So that is a common thing that we hear, but it gives us a lot of good information. I'll take this one more minute to answer one more question regarding the heart health prevention before I get back to studying. Next time you're at the doctor, just ask for you're at the doctor, just ask for an EKG. Yeah, absolutely. You just get a repeat EKG to see how everything looks. Start feeling choking in my throat, below trachea, chest. You may want to see your paramedical provider for that. A lot of things can cause that. There's not just one thing. It can be nothing, and it could be something that needs you to get an endoscopy. So, as long as you're breathing well, go follow up with your primary medical provider. Once again, this was a great time just to pop in, pop out, and answer questions regarding the heart health and prevention. I may be back tomorrow again, so it was good talk with you guys, and you guys take it easy. All right, no problem. You guys are welcome.